The PLAB2 is a performance-based assessment of clinical and professional skills, knowledge, and behaviors. Today I will be sharing how I passed all the stations in the PLAB2 when I took it. Hi, my name is Hope. I am an IMG doctor here in the UK and I just finished my foundation program. So the PLAB2 is a 16-station exam comprising 8 minutes each. The whole exam lasts about 3 hours and there are 2 rest stations in between. So the PLAB2 is essentially an OSCE, and they assume that you are answering as an FY2 doctor. And the coverage of this exam is detailed in the GMC website, which I can leave in the description box below. So my first tip is to practice cases with a friend as much as you can. I practiced with 2 friends, one online and one in person. And we practiced using all the materials we could get, like OSCE stations, sample cases, and we would time each other. One would act as a patient while one person would act as a doctor, and we would give feedback on what the person missed, what the person did well, and how our consultations could be improved. Secondly is to utilize Geeky Medics videos. So I gave a detailed explanation on how I used Geeky Medics to practice physical examinations on my How I Passed NCA video, which I can link here. But basically, watch the videos, practice doing physical exams because there might be a physical exam station in there. Thirdly is to familiarize yourself with the NHS guidelines or the NICE-CKS guidelines. You can always look up the topics you're practicing on the NHS patient information website or the NICE-CKS guidelines. So you can see a general guideline on what the current recommendations are, because essentially you would be giving advice to patients and you need to know what to tell them. You don't have to memorize everything, but just familiarize yourself because there's way too much information for you to know everything. So those are my top 3 tips and just some general tips regarding the exam. First is to time yourself. A lot of people struggle with timing the stations. So each station has an objective. Sometimes it's just communication stations and sometimes it's doing a history and examining the patient. So you need to be able to tailor 8 minutes into the consult. So always practice using a timer and see how long it actually takes you. Secondly is to remember to ICE, meaning ask about their ideas, concerns, and expectations. It doesn't have to be the beginning or the end. You just need to fit it in somewhere. So try to make it as naturally as you can. So just ask, do you have any ideas? What could be causing it? Do you have any particular concerns? Or is there anything specific you were hoping to achieve in this consultation? So just remember to do your ICE because that's really important in OSCEs. And my last tip is to not memorize. I've heard that some people fail stations or get points deducted because their answers are very scripted or feel very scripted. And some people tend to memorize the answers because they're so nervous and want to make sure to give all the information. So those are my tips. And if you have any questions, just comment them down below.